What's going on, everyone? Happy Wednesday. Hopefully everyone is doing well, staying safe, healthy, and just having a great day so far. If you had to take a COVID test, flu test, or a test for some other virus, I hope you have tested negative. If you did test positive for any of the viruses, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Wednesday edition of the Virus Update for Wednesday, March 5th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there impacting humans and, yes, animals, wildlife, birds. They're getting sick as well, so you need to be informed on what's going on with each of these viruses, because that's what I do here on my channel each and every day. Want to stay informed? Just subscribe down below. Help me reach my goal of 10,000 subscribers by the end of this year. Another way to do that is hitting that thumbs up button. The more people that do that, the more YouTube's going to push out the content. Of course, sharing this video with anyone you know, hitting that notification bell, and leaving your comments down below. Already, we do have several news stories today. Not a terribly busy news day. We've had busier days. I think we're at the backside of the winter busy news day. I hope. Watch, I'm saying that tomorrow will probably be a busy day. But we do have some things to look at. And we are going to take a look at some hospital capacity data today. I do have a list here of states that we need to look at that are over 80% of their beds being used. I believe there's 11 on the list, something like that. It's 11 or 12. And I also want to take a look at some wastewater data today. I'm seeing something on the CDC wastewater page that I have not been seeing before in a particular state when it comes to bird flu. Yes, we'll get to that in a little bit. Starting off in Texas, over a dozen new measles cases have been confirmed and reported in this outbreak, which continues to grow. 13 new cases to be exact. The total has now grown to 159. I really personally believe more needs to be done. I believe there was comments made today from RFK Jr. I believe the CDC as well, or one or the other, something about vitamin A can help treat measles. No, we need these unvaccinated people to get vaccinated. We should be reaching out and offering the vaccine to these people. If they don't want it, so be it. That's on them. But to those who want it, they need to be helped to get it, because this is ridiculous. Measles, it shouldn't be a thing, but it is a thing right now, and it doesn't stop there. Measles case reported at Miami-Dade High School. Yes, this is Miami, down in South Florida. There has been a case reported at the Palmetto Senior High School, located in Pinecrest. This is in the Miami metro area. Yes, the patient is between the ages of 15 and 18 years old. This is just not a good thing whatsoever. Now switching over to flu. This is regular flu. Bird flu will come after this. In Cuyahoga County in Ohio, 22 people died from flu-related illness. Now, it says flu-related illness. We don't know if they have influenza A. Could it even be COVID? That is possible. We have seen cases where they say flu-like illness, and it ends up being COVID. Don't know, but it says Cleveland, Ohio, a total of 22 people, including 2 children, have already died from flu-related illness in Cuyahoga County during the current flu season, according to the Cuyahoga County Board of Health. The children were ages 8 and 12, and health department officials said both had other illnesses or conditions that contributed to their deaths. So yes, not good to see that, hey, deaths are still going up from the winter surge in viruses here in the United States, and not just in the United States, other parts around the world as well. In Bernalillo County, New Mexico, I believe this is near Albuquerque, bird flu outbreak is being reported there. A highly contagious strain of bird flu found in local birds raises concern for public health, with potential risks to domestic animals and pets. Albuquerque, New Mexico. Bird flu was recently found in a flock of birds in Bernalillo County, posing a serious threat to both wild and domestic bird populations. The disease is highly contagious, and there is also a risk to humans and pets. And yes, we have seen several cases of bird flu in cats around the country. We're actually going to talk about one in just a moment. First, we have to go to this. In New York City, dozens of birds infected by bird flu at New York City poultry market. Yeah, another 150 birds at a Queens live poultry market have died due to a bird flu outbreak, according to the CDC. This is the first case in New York City since February when over 1,000 birds were infected. Bird markets in New York City, Long Island, Westchester were shut down for a week to complete cleaning and disinfection procedures. Sounds to me like it needs to be done yet again. Now let's go about, hour to an hour and 15 minutes southwest of there into Hunterdon County, New Jersey, and we find ourselves with this. Hunterdon County addresses health concerns after feline bird flu detection. Yes, a cat has died of bird flu in New Jersey. This is a H5N1 bird flu, and it has been confirmed in a feral cat. The case was confirmed by the United States Department of Agriculture and National Veterinary Services Laboratory and follows previous national reports of confirmed feline cases in other states. But it does not stop there. We have to go back to Ohio again. Geese found dead at Wade Lagoon, believed to have bird flu. Yes, now there's bird flu deaths with geese in Cleveland, Ohio. Yes, it's a bad news day for bird flu. If you not noticed, maybe that's what I'll put in today's title, something like that. The bird flu, or highly pathogenic avian influenza, HPAI, continues to ravage whole chicken and some cow populations across the country, and now is believed to be affecting some geese right there in Cleveland. Yikes, yeah. This just continues to go out of control with seems to be no end in sight. All right, let's switch gears. Let's go over to COVID now. Long COVID. Let's go over to the Netherlands, I believe is where this is at. Growing number of long COVID patients declared unfit for work. And I've been thinking lately, maybe we need to do a video, or if not a video, dedicate maybe 2 to 3 minutes in several videos in a row, period of time to the cost of these viruses. These viruses are not cheap. You may think, getting sick, it's fine. Okay, let me explain something to you. Getting sick with COVID or any other virus can lead to new health problems. Leading to new health problems can cause you to have to go to a specialist. Time off of work. Just getting sick. Yeah, you're calling out sick. Not everybody has sick days. That's costing people money. New specialists cost people money. Read what this says again. Growing number of long COVID patients declared unfit for work. You know what that means? They can no longer work. If they can't work, they can't make money. These viruses are very expensive. People have to go on disability. Governments have to pay out disability. If governments are paying out disability, it's costing the government money. It's costing taxpayers money. Yes, it really, do the math. It really does add up. People out of work, production slows down. There's a whole bunch of things that cause problems. The number of people in the Netherlands declared partially or fully unfit for work due to long COVID has risen sharply in recent years. Mind you, COVID started, we'll say 2019, but it really became the big deal in 2020. According to figures from the Employees Insurance Agency, UWV, more than 12,000 people have been granted a WIA disability benefit after being ill for more than 2 years. That figure stood at just 3,000 2 years ago. Patient organizations warned that the real number is much higher. Post-COVID, Netherlands estimates that 90,000 people in the Netherlands suffer from severe long COVID symptoms. Many of them are struggling to return to work but do not qualify for disability benefits. Yeah, this is a real problem, not just in the Netherlands, really all around the world. It's something that we really need to keep our eyes on because there's not enough being done about long COVID. I have long COVID. Millions of other people have long COVID. For me, it's constant headaches. And as of recently, I feel like if I work really hard one day, I get tired the next day. Today, I've been a little bit more tired. Yesterday was a big day. I had the MRI. I went to work afterwards. Real quickly, I forgot to mention how my MRI went. Not bad, but the place where I went to have it done, they do several other types of things. Chest x-rays, CAT scans. I think they do stress testing there as well. They do several different things. The place was busy. I only saw one other person wearing a mask. I know. shaking my head. It just absolutely drives me nuts. But hey, I did much better on the MRI than I did when I had one as a kid 20 years ago. They had, or not more than that, 25 years ago. Back in the late 90s, early 2000s. I had one, and they had to calm me down, so they gave me morphine. I know, really weird. And found out I was allergic to morphine back then. Ended up being sick for 5 days, but no problems with the MRI tomorrow. Knock on wood, hopefully I did not catch a virus there. As we know, one-way masking does not always work, and trust me, I know, because that's probably how I had COVID back during the holidays. Alright, back to today's update. Queensland respiratory surveillance, this is over in Australia, from February 26th through March 4th, 2025, reported COVID cases, 830. That's down by 11.6%. Influenza, that's up, 935, up by 5%. RSV, 646 cases, that's up by 2.2%. Hospitalizations, 136 for COVID, down by 12.8%. Influenza, 45, up by 7.1%. RSV, 32, that's stable and unchanged at this time. Taking a look at what's going on in Canada, we did get an update there today. COVID-19 is moderate, flu A is high, flu B is moderate, RSV is listed in the moderate category at this time. Taking a look at what's going on with air qualities, you may see some bad air qualities in the Mid-Atlantic region. There's still a frontal system that is moving through there, and there were some bad air qualities there earlier. Also California, yeah, Northeast, there's some spotty bad air qualities as well. Also Nova Scotia, up in Canada. We don't talk about that every day, but there's some bad air qualities there as well. Take a look at other places around the world. No, let's not try, because it may freeze this website. In Pinellas County, Florida, it's been a busy day there today. I actually made a tweet with a screenshot of this page earlier, and there were quite a few calls. And take a look now. Not one, not two, not three, not four. 5 sick person calls right now, and some other things going on as well. In Philadelphia yesterday, 772 EMS incidents. That's below 800. I will accept that. No update on flu yet in Philadelphia. Let's refresh this because, okay, this is up to date. Montgomery County, busy for 523 in Eden. We're a little late with our update today. Respiratory emergency is showing up 1, 2, 3 times. Cardiac arrest is showing up. Cardiac emergency. Yeah, there's definitely some problems going on there. Chester County, Pennsylvania, just 4 calls right now. One of them being a sick person call. Taking a look at the hospital situation in Pennsylvania, and I do need to refresh this just to make sure it's up to date. Yikes, it looks like it actually got worse when I refreshed it. Harrisburg area, there is a hospital there. Penn State Health Holy Spirit Medical Center, a problem going on there. Emergency department, overcrowding. Yikes, they are on total divert. That's not a good thing. We got some problems up in Reading. Lehigh Valley is just getting slammed with issues there. And it does look like overcrowding. Not seeing the words psychiatric issue today. Here's a behavioral health diversion at Lehigh Valley Hospital, Muhlenberg. Problems going on St. Luke's Monroe. Also looks like St. Luke's Carbon. And what's this one? Geisinger St. Luke's Hospital. Yeah, problems there. And even up in Wilkes-Barre, Scranton area. What is going on up there? Lehigh Valley Hospital, Dickinson City. A behavioral health diversion going on there. Hopefully better conditions over in New Jersey. We do see some problems there. Cooper University Hospital and RWJBH University Hospital. Full and total divert status at this time. Alright, taking a look at Pennsylvania, and we do need to look at the latest update from Pennsylvania that did come out. Influenza trends. Influenza activity is very high, but continues to decrease from previous weeks. 187,117 laboratory confirmed cases have been reported this season, and mind you, that is likely a big undercount because, prior to the COVID era, who would get tested for flu? Yes, some people would, but it's not as common as it is now, and even at that, there's still some people out there that say, oh, it's just a cold, it's no big deal. Hey, you may have flu, and we do know this is not an at-home flu test, but we do know those multi-tests do exist for at-home flu testing, so that could be some of the cases as well. The percent of emergency department visits resulting in an influenza diagnosis is decreasing for all ages statewide, but is still high in the 0 to 4 and 5 to 24 age groups. As of 2-22, New hospital admissions for influenza were high for both pediatric and adult patients and increasing. Hospital admissions for influenza were increasing for adult patients. And you know what? We have been seeing it in wastewater. Can I go back here real quickly? Yes, I can. Do I even have this set up? No, that's RSV. RSV was increased once again. But take a look at this. Influenza in wastewater in Pennsylvania is once again increasing. So that is an issue that's not good. And it could be the reason why hospital admissions for flu in Pennsylvania are increasing. And so far this season, 585 influenza-related deaths have been reported in Pennsylvania residents by the National Center for Health Statistics. RSV trends, activity in Pennsylvania is decreasing. This is good, but again, I noted that RSV, let's go back to that real quickly. RSV in wastewater, you can see there is an increase at this time. 41,191 laboratory confirmed RSV cases have been reported this season. The percent of emergency department visits in RSV is decreasing statewide in Pennsylvania, and new hospital admissions for RSV are decreasing for adult patients and low for pediatric patients. COVID-19. The percent of emergency department visits with a COVID-19 diagnosis are low statewide for all ages. I really don't understand how that's low. We've had one of the highest number of hospitalizations in the country for COVID in the United States. So, yeah, here in Pennsylvania, I don't know how true that is, that it's actually low. I don't know what their definition of low or high would be. As of 2-22, new hospital admissions, yeah, take a look at this, emergency departments, and low as well for admissions, and decreasing. 900 COVID-19 related deaths have been reported in Pennsylvania this virus season. That's still a lot of deaths. Let's go over to hospital admissions, because I do have to report some good news. This is actually really good news, and CJS will probably include this in his report, I want to say, on Friday. COVID-19 hospital admissions in the state of Pennsylvania. Check this out. Adults, 961. Yes, adults is finally below 1,000. Pediatric is still at 55. It's still over 1,000, but the point is, take a look here. It is finally dropping, but it did go up a little bit. This is actually, there's a little sliver of bad news within this. Pediatric actually went up ever so slightly. All right, influenza, which you saw when I first switched over to this section. Influenza, adult, 3,255 hospital admissions for flu still. Yeah, that's a lot. And pediatric, 304. We need that number to come way down. RSV, what is going on with that? RSV at this time, adult, 447, pediatric, 117. So, yeah, there's still a lot of people in the hospital for these respiratory viruses, and that's not including all those mystery viruses, colds, rhinovirus, all that type of stuff. Taking a look at New York State cases, then we'll go to the hospital picture there. And in New York State, looks like 643 new cases were reported today, and the hospital situation there is 757 hospitalized, 73 people in the ICU, and we do have to take a look at New York City. In New York City, at this time, here it comes. I do have some good news. New York City is still dropping slightly. 330 hospitalized patients and 36 in the ICU. Virginia, take a look at this. Emergency department visits for COVID are stable. That makes up 1% of the visits. 4.8% of them are for influenza, and that is trending down at this time. And RSV, just 0.1%, and that is stable at this time. Alrighty, continuing on here, we do need to take a look at some hospital capacity data. And I do have a list of states here that have over 80% of their inpatient hospital beds in use. And we're just going to take a look at inpatient beds in these states. We're not going to take a look at ICU because that would take up too much time, and we're approaching the 20-minute mark. So starting off here, I do have down here that we need to take a look at Washington, D.C. Well, let's see what's going on in Washington, D.C. 82.5% of all inpatient beds are currently being used in Washington, D.C. at this time. And in nearby Delaware, check this out. This one is not good at all. 87.5% of the beds are being used in Delaware. So you definitely have a hospital capacity issue there. Going down 95 to the state of Florida. And we do see in Florida, 80.3% of the beds are being used there. And I must tell you, there were a high number of states that were just below the 80% threshold, like 78, 79%, 79.5. Yeah, there were several states that did not make the cut, so we could potentially see this go up higher, the number of states being next week, and Georgia was not on the list, but Georgia is currently at, where is Georgia anyhow, since we did click on it, 73.7%. Massachusetts, we have to go back north again. Massachusetts is on this list. This is not good whatsoever. Massachusetts at 86.8% of beds being used. Maryland, yeah, the East Coast is getting hit really hard in the hospitals right now. 85.5% of beds being used. Going up north again, Maine this time comes on the list, and Maine is at 83.6% of beds being used. New York State, take a look at this. New York State is not doing good whatsoever. Where is it at here? Here we go. New York State. It is at 81.5%. And then we go up to Rhode Island. I'm telling you, the Northeast is doing really bad at this time. Here's Rhode Island. 87.4% there. Yeah, that's almost 90% of your beds being used. You're running very low on hospital capacity, and guess what? Vermont makes the list as well. You do not see New Hampshire or Connecticut in here, but I've been keeping an eye on it. It's not there. Vermont, 84.6% of beds being used, and you're probably wondering, data report mentions something from the West Coast. Okay, I will. Washington makes the list as well. And we can see here Washington, 88.9% of your beds being used. That's really bad. That's almost 90%. And then we come back east again. West Virginia, take a look at this. West Virginia is currently using up 81.7% of the bed capacity. And I'm going to show you California because, why? Because, well, I didn't show much in the West Coast. So here's California. And to prove to you, yeah, 78.9%. That could easily make the list next week. And let's go somewhere else out on the West Coast as well. Let's see what's going on in New Mexico, shall we? Here's New Mexico, and we can see New Mexico does not make the cut by far, 59.9%. And believe it or not, I think the best state is Wyoming at this time. Yeah, here it is, Wyoming, 41.4%. If you live in Wyoming, plenty of capacity in the hospitals. Hope you don't have to use one of the hospitals. All right, I have to show you something from the CDC. I thought this was rather interesting. This is a map for wastewater, but H5 detections. Now, we know that there are detections in California. We also know that there is a detection now in Nevada. I'm wondering if that's new. I don't think that's new in Nevada. There's some detections in New Jersey at this time, but let's take a look at this. Let's zoom into the Northeast. Yeah, Boston, Massachusetts. I don't recall seeing this on the map before, an H5 detection in the Boston metro area. That is concerning. We'll have to see if anything comes of that. Hopefully nothing comes of it, but it means there is H5 in the area, whether it be in a human or in some sort of wildlife. It is being detected in wastewater, and this is a big wastewater site. 2.4 million population. So yeah, I thought I would share that with you today. Alrighty, that does it for today's virus update. Tomorrow's Thursday. We'll have updates from Ohio, we'll have Colorado, we'll have the state of Washington, and maybe some other stuff. I try and include as many areas as possible, but when I don't have new data for certain areas, such as the West Coast today, or other countries, I can't report on it. I can only report on the news and data that I find. Alrighty, if you enjoyed this video, give it a thumbs up. Subscribe down below if you're new to the channel. Help me get to 10,000 subscribers. Hit that notification bell, share this video with anyone you know, and leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Wednesday evening. Thanks for watching. Take care.